to be here. Scott Vogel with the Virginia Department of Health. There's the microphone, I hear it now. VDH, ironically, is the health department, and we are not good at getting that kind of water quality data for wells. So we have to rely on the Virginia Household Water Quality Program for that stuff. So I get to talk to you today about what we are better at collecting data for, and that's well location, well construction, and that sort of thing. So yeah, let me talk about that. If I can figure out, not the TV, point to the back, okay. Here's my contact information, so if anybody ever wants to reach out and talk about wells and what's going on in Virginia or anything like that, or collaborate, there it is. I don't have to even talk much about this slide because we've already had a presentation from Virginia, so we know that there's 20% of the folks in Virginia relying on private wells, and we're estimating about 700,000 potential wells private wells in Virginia. The Virginia Department of Health is the office that regulates wells, private wells in Virginia and public wells. The Office of Drinking Water regulates the public wells. The private well program regulates the private wells. So we've got 35 health districts, and that equates to about 119 offices across the state. Those are basically every county and every city in the state has a local health office, but it's all under the state office. It's not like there's, with the exception of a couple counties in Northern Virginia, it's the state health office. It's not a county by county office. So VDH, of course, the mission is to protect public health, but we also have this cultural value that's been recently developed for making data-informed decisions. So that's kind of what ties in with this project and a lot of the projects I've been able to work on lately to kind of bring that forward. We've got tons of data. We're good at collecting data. We're not very good at using that data. So there are many different offices at the Virginia Department of Health, and we've got emergency preparedness, we've got the epidemiology folks, and environmental health is the office that I work for. We regulate a lot of the environmental health things like milk, food, sewage, and then private water. We do campgrounds. We even do rabies investigations for the Office of Epidemiology with the state. I forgot my coffee. Oh well, I'll be all right. So within my office, the Office of Environmental Health Services, we're divided into a couple of different divisions. I have to give most of the credit for this to the Division of Data Management and Process Improvement. We call them DIMPI. I know, it sounds much better than saying Data Management and Process Improvement. Particularly Tessa DeWalt in the center to the right. She's the one that's really done a lot of the work of putting this together and making it a cohesive thing that can exist. So lots of credit to her, and then Megan Sensman, who helped develop our GIS tool that we also have showing well locations and septic system locations. So then we've got the private well program in Virginia. So I'm wearing many hats and many different birds on my hats. So it's a one-person team. Not really a team, I guess, because it'd have to be an I somewhere. So we don't have a lot of resources as far as, at the top level. I have to work with the local health departments to do the enforcement, carry out the actual program. So I'm wearing a lot of different hats. I do work super close with the sewage program. I do a lot of training with them too. So there's 2 people in the sewage program. So that makes 3 of us that are working on these programs and trying to make the state survive those. Oh, okay. So VDH again regulates the well construction and location for private wells and public wells, and then on-site sewage disposal systems, small discharge systems. DEQ regulates pollution, groundwater withdrawals, and resource planning and stuff like that. So as far as the timeline, quick timeline for the kind of all things wells in Virginia. In the 50s, 60s, and 70s, wells were not, there was a lot of suggested material, like we suggest you do this with a well construction and that sort of thing, and there wasn't any regulations. And what regulations there might have been were attached to sewage permits. So if you're getting a sewage permit, you're usually getting a well too, so we had some authority to regulate. So it wasn't until 1986, which was very surprising to me that it took that long for Virginia to actually have the Private Well Construction Act to direct us to create this big set of regulations to regulate wells. So the Virginia Environmental Information System didn't come along until the year 2000, which was actually about the same time that I was hired with the health department. I started as an environmental health specialist, so I did restaurant inspections, I did sewage and well permits, rabies, all the stuff that all the environmental health specialists, the different hats that you have to wear often in those jobs. So we worked on that database for about 18 years, and right about when we had it working perfectly and it was usable, they decided we need to go in another direction. So we took a Lotus Notes-based database and we contracted with HealthSpace to make it an online cloud database. So all that effort that we put into that database was sort of lost, and we had to convert over to the new database, which created a lot of problems with our data. What kind of data do we collect? So we have the GW2, the well logs. I'm sure folks across the country are collecting similar information from well drillers. Well logs, we also call them uniform water well completion reports. They have about 100 data points on them, and I think it's kind of unique in Virginia, comparing to some of the other programs, that we've actually been collecting them and also entering them in our database. So not only are we getting the well log and attaching it to a particular well or well location, it's actually being uploaded into a database where we can use it for some broader questions. So again, with the Private Well Construction Act that came out, VDH's primary reason with wells, was well construction, regulating well construction, having well applications and permits and things. So we get about 34 data points with the well application. We get, by the time we do the well permit and the inspection reports on the wells and the approvals, we're collecting about 100 data points, and then with septic systems, it's about 170. So we currently have about 347,000 wells in the database right now, and 512,000 sewage disposal systems. So we're halfway there. That's pretty good, right? I mean, I'm a glasses half full kind of guy, so I think that's really great that we've come this far with our data. Amazingly, we're at the same point with the sewage disposal systems. We estimate there's about 1.1, 1.2 million sewage disposal systems in the state. So we get the applications at the local health departments, the environmental health specialists, and the office support enter all that information into the database. And since the start, there's been limited accountability for that data that goes in. There really hasn't been any QA/QC on it. There's been very limited training because of all the problems that we had with the database at the different points in development over the years since the year 2000. And there's so much data that goes into that. We've got, like, if you're doing a sewage disposal system in a well, that's 300 plus, fields that are being entered. So you can picture the environmental health specialists sitting there, spending a lot of the time doing data when they could be out doing the important work of restaurant inspections and sewage and well permits. Add to that the slow internet speeds with a lot of our offices that are in rural parts of the state, and it can be pretty frustrating. There was some issues with transferring the data from the old database to the new database, so there's been a lot of suspicion about a lot of the data and a lot of work we've had to do to improve that data, bring it up to our standards now. So this is the perception by the local, the environmental health specialists, is that we collect all this data, they're spending all this time entering the data into the database, and it's a black hole. It's going in and it's never coming out. More appropriate for the private well program, it's a dark well and it's all going to the bottom of the well. So, there we go. When data does come out, it's very limited because there's not a lot of people that know how to get it out. It takes a lot of time to do it. It's amazing how inconsistent, like I've tested this many times with DMP, the data management folks. Like I would pull the data out, they would pull the data out, how they think it should be pulled out, and then like somebody else on their team would pull the data, and it would never match. It was just like mind-boggling that there was so many different ways to go in there and process the data and see it, and it would just be a mess. And then you have to, when you're taking it out, you're usually having to work with huge, with 300,000 plus, data wells, and then the 100 data points plus. So you're working with these huge files of data. Again, the attitude and perception for those folks entering the data, is why bother entering all this information? It's not my job. So, we started to go down the route where folks weren't doing it at all across the state, or they are just questioning it and trying to get rid of a lot of that data entry. Again, reports that came out were very limited. It was often the bean counters, so to speak. It was the folks that were interested in how many applications we were getting and how many permits we're issuing and how fast we were issuing those permits. So like the basic data that actually, when it did come out, it was sort of used to make sure folks were doing their, it wasn't a positive reason to be informing people that it took you 30 days to do these applications and stuff like that. So hopefully we can change that. And again, you not only have to know how to process that data when you're taking it out, you have to be able to maneuver through the database because there's so many different layers to figure out, like septic systems and then each component of the septic system, or with the well approvals and the well permit information and the well log information, so it's very complicated. Until now, so early on with AI, I had to get pictures and stuff for presentations, so I was playing around with it before I knew how water-intensive AI would become, and I wanted an 8-bit graphic of a well, and it gave me an explosion, so I have to use it. So picture an exploding well with all that data coming back out. Or the moose in the well. Did you guys hear about the moose last year? Yeah? Yeah, to me too. I'm from Maine originally, so everybody knows that the well. So we're taking the moose, representing the data, out of the darkness, setting it free again. So, so this is the data dashboard. There's 6 different tabs at the top where you can go through the different categories of data that we've created. It's spatially related, so we have the different maps. You can sort the map by the data and by local county or district, and it gives you kind of the heat map for each of those. And then, so I'll talk about those. But before I do that, I'll talk about CDCs, where we got the funding to work on this project. So 2020 is when the Environmental Health Capacity Grant became available. Is anybody familiar with that grant? Yes, so I know some of you probably been working on that too. So our method of applying for the grant was to apply for like 1,000 projects, thinking we would get funded for one or two, and we got like all the projects funded, which, again, with like the glass half full, half empty, I have to be the person to work on that grant and do all that work. But also, it's given me the opportunity to place a lot of emphasis on wells, my program, and take advantage of some resources. So I mentioned health space. So health space GovTech, they're the folks that they worked with us on the first database, and they also worked with us on the second database. So they're kind of partners in all of the requests and problems that we have, helping us kind of find solutions for that. So Dimpy and I, the private well program, just I, we did a lot of processing of the data within ED, or pulling it out into Excel. They used Tableau to do a lot of the visualizations and stuff. So immediately there was tons of data cleanup that was needed. So we had to go ask the local health departments to do cleanup in a lot of the situations. And then we also had automated agents that would go in, programs that would go in and fix the data as well. So did a lot of data cleanup, which was great for wells and the sewage disposal systems. So that's kind of an ongoing thing, but we've taken care of a lot of the major issues with that. And then we decided on how to display the information, how it made sense, with pie charts and things like that, and developed it. I don't know anything about Tableau, I'll just say, but that's basically the way that this has been. It's the framework for the dashboard. I've tried to use it a couple times and I'm not very good at it, but Dimpy has become very, very good very proficient with using it to make the maps and everything. So after many, many revisions and debates about what to display, it did go live March 2026. When I say live, it's a partial launch. We're only displaying data right now from 2020 to 2026 because that's the data I'm very comfortable with because I've been part of the private well program for that long. And it's also, yes, so we're just doing the data from that time frame, and it's going to be internal for a while. So hopefully by the end of the year, we'll have this available externally for well drillers and the general public to see it. So for the first time, we can actually, so this is the first slide from my well training that I do every year. I ask what is a well, and then go on to define it through the regulations. But now we have a clearer portrait that's kind of painted of a well, so we know the average well depth in Virginia is 295 feet, 45 feet of grout, usually bentonite grout. We know 100 feet of casing, and usually PVC, so that's pretty neat. Even better than that is we can go to Northampton County and see 175 feet deep, 29 feet of, the averages for that county, and then go to the mountains and do the same thing. So we can get a real a much more clear picture of what's going on in the different parts of Virginia, according to geology and what the circumstances are out there. And it actually makes sense. A lot of this data, it actually makes sense for the conditions out there. Shallow to bedrock in Wise County, but you have to go really deep to get water. And then in the coastal plain, you're going deeper to get to the better aquifers for the better water quality. So you're using more casing, not necessarily as deep with the grout. So One of the tabs is well depths. We can look at the, whoops, I can see how easy it is to mess this thing up. It really is. Yeah, so we can look at the well depths across, like I was talking about. We can look at the ranges, the hot spots. We can kind of get a nod to compliance with are the wells, complying with our regulations. We can look at the water resources. It's kind of true with all of the fields, really, those things. We can look at the materials. All the materials are being entered, so we can look at whether it's bentonite or, the PVC versus steel, which was great for the regulatory side of things, because bored wells, for example, nobody does bored wells anymore in Virginia except for like one company, and I'm pretty sure they're going to be done with pretty soon. So, that's something that we can kind of phase out with our regulations, or maybe kind of look at the regulations to be a little bit different for bored wells in the future. A great thing, not a great thing, a bad thing, but a great thing for me to see is also the null data. So this yellowish orange stuff. There's a lot of null data in the database where people still aren't, probably because of those attitudes from all the problems before, they're still not entering the data. So now I can have a quality, QA/QC on the data to see where things are being entered or not being entered. Which will give us the opportunity to not just see the problems and say, hey, do this, but it's going to be more of looking at the data flow, the workflow. How can we make it really easy for you to enter the data? Like right now, you have to go through the, sometimes 5, 10 pieces of paper plus the application to get the information. It's not in order or anything like that. So if we can get things in order of the way that it comes in, then it'll make data entry that much easier. So we can, again, with water production, that's one of the tabs, look at the hot spots, look at the compliance. We're in a drought right now in Virginia, so it'll be interesting to see how some of this data starts to show with wells being replaced or having to go to different water sources deeper to drill for water. We can look at well uses. We've got 5 use categories for wells and different well types, so we can see what's going on with the agricultural industry or commercial wells like data centers. That's going to show up. I might even add an extra category for that because that's becoming such a huge thing. Is it 11:45, right? Yeah, you're doing okay. Good. Thank you. So, and then the bean counting still in there, right? So we still have the applications, how many applications are coming in. That stuff's still very important because it helps us figure out, where the hot spots are again, where we can shift resources to help with where there's a lot of well permits coming in versus where there's none coming in. We got the information on installed wells, so all the wells that are applied for don't necessarily go in, so we can kind of take that data out. And also a thing to point out is the null data on that. For some reason or another, folks are not going back into the database to approve wells. So I know that's something I definitely have to work on next is people have to go back and actually issue the approval for the well. They're doing it on paper right now, basically. One of the really interesting things that I noticed with our database, it was really unintentional, but it also is tracking workforce, and we didn't even know it. So we can see our workforce, our environmental health staff, how many are available to do work, what are the resources like for them, how are they distributed across the state, and then we can look at the private sector. We can see how many well drillers are there, where are the well drillers doing their work, where are they located, where are the areas where we don't have well drillers and they need more resources. So yeah, this has been a great project for looking at we have our relationship with the private sector in Virginia is that we're trying to transition a lot of our design services to the private sector to do the actual permits, submit them to us for review, and then we go and do the final inspection, basically. So, of course, The hardest thing is actually setting this thing up and getting it to work properly. Now that we've done that, I mean, the sky's the limit on this. We still have hundreds of data fields that we aren't using right now. So as we talk to stakeholders and other folks, we'll be developing, we'll be adding to it, I'm sure. Water quality data, maybe we can add some of that to it as well, in addition to the mapping and the data stories and stuff like that. So a brother of this project, or sibling, is the dashboard is actually in the database now too. So our dashboard that's outside, that will be available to our staff and the public, that's kind of the good data, like it's been manipulated and processed a little bit. Like this is all raw data coming right out of the database, live, like instantly. So folks can go check that out, and this is another good compliance thing from the perspective of the local health department, because they can automatically see, like, there's a maximum well depth of 9.8 million feet. I mean, that's, somebody's keyboard got stuck or a decimal, something happened there, yeah. So you can see that instantly now, and if you look at the map down there, it looks like those little purple things are the dots, right? For the well locations, instantly being mapped, and there's a lot of them spilling out of Virginia somehow. So, yeah, that's a clear problem. We've got wells in Europe and Asia and the Pacific, so, yeah. I'm not going to go into detail about the GIS tool. We've done presentations about that. Oh, I meant to say with the CDC funding, so when you're in that project, they encourage you to do presentations of what you're doing. They wanted me to go to AEC, the NEHA thing, and I said, no, there's a private well conference, so I should do that. So thanks to them for allowing me to do that and being funded for travel. And thanks to the private well conference for keeping it cheap, because we still had money left over to send somebody from the data management team to go to NEHA, so they're going to go and present on this or other things. So yeah, but we do have a GIS tool that shows all of DEQ's, our Department of Environmental Quality, all their data on environmental hazards, flooding data, everything we could find we've thrown up on this map for looking at wells, septic systems in relation to other things. So yeah, the future, we're collaborating with Virginia Household Water Quality Program on many different things. We're going to update these, continue to update this dashboard. We're going to very quickly add the data from at least the year 2000 to 2020 now. It's been processed. It's just a matter of letting it, putting it in there to do it. And this will, again, continue us down the road of data cleanup and process improvement for how things are being, the data flows being entered in. Yeah, so hats off again to Virginia Household Water Quality Program for all the great collaborations and things they do with private wells. 5 minutes, okay, so last slide. So, well, third to last. So the change of attitude, so again, so this is, it's not a black hole anymore. The data's coming out, people see that. People are realizing that their work matters. It matters to me, it matters to the bean counters, it matters to everybody, not just that they're issuing permits, that we're getting great data that we can use from doing the data entry part of things, and they can work together with me and the data management team to improve things as best we can to make it easier for everybody. And think about the public health implications behind all of the data, and maybe we don't need to collect some of the information that we're collecting. Maybe we need to collect other information, like the water quality piece of it. So, EH staff, less of this, hopefully, and more of, out in the field doing the public health work, doing a soil evaluation in this case. And that's it.
All right.
Thanks. I can't find the statewide search location to view all well records. Am I missing something? No, you're probably not missing something. So this thing is internal right now. We do have the GIS map that's external that you can view that. We have a FOIA portal that you would go through. Like if you were doing a search for well records, you would go through the FOIA route, which is kind of not the best route to go through. If you need well data, contact me. I can get it to you for free. So yeah, hopefully that's one of the things that we're gonna start digitizing, the application and all that good stuff, so that will be more available. Yeah. Is there a timeline set for drillers as to when they need to submit the well log? Yes, 30 days by the regulations after construction. Yep. Do you have authority to do anything about the specific driller that doesn't provide data? Yeah, okay, so that's a different thing. So what I'm looking at with the null data is the data that's not entered. So it's our staff not entering the data. That's a whole nother thing with the well drillers. Yeah, that's something I'm working on all the time to try to make sure they're entering the information that they're supposed to be. And so I work closely with the Virginia Water Well Association, and that's one of the things I've talked to them about over the years. And yeah, I think for the most part, they do pretty well. And plus, our staff is getting better at reviewing those well logs and rejecting them if they don't have the public health. It's all about the public health relevant information. If it's not on there, reject it.
We'll do one more.
Have you received public record requests from well owners to get well logs for the wells? Yeah, so that's a daily, all the time thing. Do they have a guide on how to go about finding the well logs? It's just a matter of calling the local health department. That's not really a FOIA request. That everybody has a right to their records, and we're happy to provide it. We can fax it, email it, yeah, and or they can show up at any of the health offices. That's one of the advantages. At least we have an office in every county, so we're usually pretty close to everybody. They can go in and get all that information that they need.
All right.
Yeah.
Thank you. We're gonna end.
I need coffee.